Have you ever been stressed about your doe giving birth? Well, I have a perfect solution to ease your worries. Hi, my name is Jillian Sayler. I'm an intermediate member of the Feathers, Hairs, and Hooves 4-H Club. This is my 5th year in 4-H and my 4th year in the Dairy Goat Project. In my demonstration titled, Just Kidding, I will be sharing what you need to birth a goat and the signs of labor. Knowing the signs of labor is important. Knowing how your doe acts normally is the first clue to when your doe will give birth. As your doe due date gets closer, her behavior may change. Your doe may want to be isolated and away from the herd. A friendly doe may become a bit wilder, and a wild doe may become a bit friendlier. A few days before your doe gives birth, her belly will drop, making her spine and hips stick out. This is the kids moving into position. The sign I watch the most from my goat is her ligaments. Goats have two cord-like ligaments that run along the spines towards the tail and are about the width of my finger. Once my doe Ruth's ligaments are completely gone, it will be around 24 hours that she will give birth. Not all does will have a strutted udder before they go into labor, so this is a less reliable sign. Some does will get such a full udder that it almost looks shiny. This is called a strutted udder. Another sign to watch for as kidding gets closer is discharge and a more relaxed looking vulva. My doe Ruth is a Nubian, and they are known for being very talkative goats. Several days before my doe Ruth gives birth, she will lean her head towards her tummy and start talking to her babies. Now that you know the signs of labor, you are ready to get prepared by preparing a birthing kit. This is the container I chose. When you are choosing a container, it is a good idea to have a nice handle and strap to hang on the wall and a waterproof bottom. Gloves are important protection for both you and your goat. I like to include both regular gloves and OB gloves. OB gloves are nice for if you need to go in and reposition a kid during a difficult delivery. OB lube is helpful for if you have an emergency that you can go in and reposition a kid. A suction bulb is important to have on hand so you can suction out any fluid from their nose and throats. A thermometer is important to have on hand to monitor your doe's temperature to make sure she doesn't get an infection. A stethoscope is important to have on hand to listen to your kid's lungs or heart if they seem to be struggling. An iodine solution is helpful to put on your kid's umbilical cord to help prevent infection. Baby wipes have too many uses to be listed. A pile of clean towels will be helpful for drying off your kid. Puppy potty pads are helpful for putting under your doe during delivery. A bottle and nipple will be helpful for if your doe does not let her baby nurse or if your kid is too weak to be standing. A flashlight and headlamp is important because you never know when your doe will go into labor. A bucket is useful for warm soapy water to wash your hands or to wash after birth off your doe. Since goats are curious by nature and they like to eat things they shouldn't, make sure to include a garbage bag and keep your cell phone nearby in case there's an emergency. So make sure to put your vet's cell phone number and a few other emergency contacts. Once your doe delivers her kid, make sure her kids are breathing. So that's when your stethoscope will come in handy. Suction bulbs are nice for sucking out any fluid out of your kids' nose and throats so that they can breathe easier. An iodine solution prevents infection in the umbilical cord. It is very important that your kid stands and nurses as soon as possible to get that life-saving colostrum that they need. If your doe has not been given a CD&T vaccine 30 days before your kids gave birth, your kid will not need it until 4 weeks old. After your doe gives birth, there are a few things that you need to do for your new mama. I give my mama during and after delivery warm water and molasses to give her energy. I make sure she passes a full placenta. I monitor her temperature to make sure she does not get an infection. And I clean her stall to make sure there's no wet or dirty straw, to make sure that the babies stay nice, warm, and dry. In conclusion, I would like to remind you to keep a close eye on your doe if she gives birth at night as well. It is important to put together a birthing kit in an emergency if you need help, to be able to have your cell phone nearby. I obtained my information from my 4-H leaders, the 2018 March issue of Goat Journal. Are there any questions? If there are no further questions, this concludes my demonstration. Thank you for listening.